Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Investigations that are to be carried out when you suspect ASCVD. First and foremost investigation is ECG. We call it as electrocardiogram. It will record the electric signals of your heart, and if there is any ischemia, death of the heart muscle or malfunctioning of the heart muscle, we will come to know in ECG. And also we can take the same ECG in treadmill, that we call treadmill ECG. So we ask the people to walk briskly or run on the treadmill, and we'll take the ECG so that we can check whether exercise is precipitating the heart attack for these people. And one more thing is CT scan. CT scan, you can see in the CT scan you can see atherosclerosis only if calcium is deposited. If calcium is not deposited, you are not going to see anything in the CT scan. Next one is 2D echocardiogram. 2D echocardiogram clearly indicates the function of your heart. So how much percent your heart is still functioning, so which chamber is functioning, which chamber is not functioning, you can see in 2D echography. Next one is coronary angiography. Coronary angiography is, you can see the blood vessels of the heart very clearly, and you can also determine how much percentage of the blood vessel is narrow, so that is clearly seen in coronary angiography. Next, lipid profile. Lipid profile is very important. Elevated LDL levels and decreased levels is the indication for ASCVD. So we have to check blood sugars, postprandial blood sugar, random blood sugar, and also fasting blood sugar, so that we will come to know what is the carbohydrate level, or and also we have to check for HbA1c, which will clearly determine whether you have your glucose under control for the last 3 months. So all these symptoms which we are developing in future, we are going to see, or this because of malfunctioning of glucose metabolism. This is all due to glucose metabolism and also other things. We will look deep into it. So, and also you can check for cardiac troponin I and cardiac troponin T. These two are the contractile proteins within heart. So under normal circumstances, when there is no ischemia or death of the heart muscle, they should be in certain level. When their level increases in the blood, it means the person has undergone heart attack. That is a test for cardiac troponin T and cardiac troponin I. Before we go on to understand the disease, we have to understand normal structure and functioning of the heart. It is very important. So, heart is a hollow muscular organ. It has 4 chambers. Left ventricle, lower left chamber, we call it as ventricle. So from the ventricle, a big arteries arise. We call it as aorta. So aorta is the main artery that is going to supply blood to entire body. At the starting of aorta, they have a small space that we call as aortic sinus. From aortic sinus, there are two blood vessels that are arising. One is left coronary artery on left side and right coronary artery on right side. These left and right coronary arteries will further divide and perfuse all the heart. Means these are going to supply blood to the heart. So this is the structure of heart. And what is the function? Heart is going to supply oxygenated blood to entire body, and it takes the deoxygenated blood from entire body or entire all the tissues and pushes it to the lungs. Again, in the lungs it oxygenated and it is again moved to entire body through aorta. So this is the functioning of heart.